Good evening, Team CMS, and welcome to our employee forum, an opportunity for you to have your questions answered by CMS leadership staff. Before we get right into everything, I want to just thank everyone who has participated, who has provided and submitted questions, and to those of you who have provided opinions via the app to demonstrate which ones are considered most important by you and your peers. Thank you for that. We had more than 630 questions, 634 questions were submitted, and more than 8,700. We had 8,730 participants either submitting or voting on which questions to consider most important and make sure that we share that information with you. Thank you again for your participation. Before we begin with the questions and answers, would like to establish a few ground rules just for clarification. This forum is designed to answer questions. We did receive some questions that were speculative in nature. We will do our best to answer those as matter of factly as we can. And some submissions provided some opinion statements rather than in the form of questions. We have done our best to try to phrase those in the form of a question, and we'll provide answers as best we can. And finally, just want to say that we did have, out of the 634 questions, several, in fact, many were duplicative, and so we've attempted to consolidate those into questions in the same category so that we are not answering the same question several times, and we have more time to get to questions unique in nature so that we get the most information that we possibly can to all of our employees. And with that, we will start. Now that ground rules have been set, I'm going to just have each member of the panel share name and role within CMS before we begin with the questions. And I'll start with you, Monica.
Yes, I'm Monica Damian, the Coordinated School Health Specialist.
And Kathy.
Hey, good evening. Kathy Elling, Chief School Performance Officer.
Thank you. Jeff.
Jeff Mitchell, EHS Manager.
Randy.
Randy Davis, CMS Communications.
Rick.
Rick Camp, Director of Custodial Services.
Matt.
Matt Hayes, Deputy Superintendent for Academic Services.
Laura.
Laura French, Executive Director of Employee Relations.
Makisha.
Makisha Mills, Human Resources, the Human Capital Management Team.
Fakhar.
Fakhar Shahbaz, I am the Director of Maintenance and Engineering at Building Services.
Brian.
Good evening, everyone. I'm Brian Kingsley. I'm the Chief Academic Officer. Thanks for joining us.
Kevin. We'll come back to Kevin. Colette. Colette, you're muted.
Okay, well, this is Kevin. I thought I was unmuted, but Kevin Earp, Director of Safety and Risk Management.
Okay, thank you, Kevin. Carol.
Good afternoon, everyone. Carol Stamper, Deputy Superintendent of Operations.
And Tom.
Good afternoon, everyone. I am Tom, a communications specialist for CMS.
All right. And we'll give Colette one more shot. If we can't get Colette through, then we'll have her unmute when she is answering a question. we're going to go ahead and move forward then in the interest of time and go ahead and get started going with our question and answer period here. And I believe Colette may only be here in the background, so that's why we can't hear her on mute. We'll start with the first question. This question is for HR or academics, and that is, why can't teachers work remotely on Wednesdays?
Thank you, Patrick. I'll go ahead and start with this question. So we have, as we've transitioned to an AB format with our elementary school teachers with K-5, our K-5 teachers will have the opportunity on Wednesdays to work potentially remotely unless the principals have things that they need to report to the school for as far as PD and some other things that are school specific. That is because the governor relaxed the plans for K-5, which allowed us to modify their rotations. We do not have any clear guidance at this point in time that anything's on the horizon to change for middle or high school. If the changes for middle and high school happen the same way they did for elementary and we're able to transition to an AB, that may be a possibility that we have for there in the future. I know my partner in crime here, Mr. Kingsley, is going to share some other information around that as well.
Thanks, Dr. Hayes. Yes, as a mandate, as a result of our school calendar being built on instructional hours, we also have to offer 1,025 instructional hours over the course of the year. And while Wednesday is an asynchronous day, we are still providing small group instruction in many cases, as well as having instructional activities for all of our students across the districts. As Dr. Hayes alluded to, as we get new guidance around how to best approach that for our secondary students, I know it's certainly top of mind for our district design team to begin taking a look at asynchronous time for our secondary students. But we feel really confident based upon the feedback that we receive from our teachers that approaching it in this way is in the best interest of faculty and or students.
Thank you. The second most voted upon question relates to any plans to offer free COVID testing to staff or partner with other locations. You all employees throughout the district received information this morning about some upcoming testing, free testing, and we have a special guest planning to join us from the Mecklenburg County Health Department a little later, and so we're going to hold off on answering that question, but wanted to address that in the order that it was placed in the importance. And we will get to that with some news. Our next question is for academics, and that is, how are teachers supposed to teach virtually and in person?
Thanks, Patrick. I'll take this one. Well, I think it's really important for me to acknowledge on behalf of our academics team that we know that there will be challenges with this. This is not going to be something that we're going to say is going to be easy across the districts, but we have great confidence in our school principals that they've been working with our school leadership teams on identifying a master schedule that creates best case scenarios to set up our teachers for success. What I mean by that is, in many cases, especially at the elementary school level, we see teachers that are beginning to split their instructional blocks to divide and conquer responsibilities. In some instances, we have teachers teaming with each other, where a student may actually gain a teacher in our Plan B remote instruction, where they have one teacher that is assigned for their live synchronous instruction and another teacher who may be supporting them in small group instruction or on the asynchronous days. We see a lot of schools also leveraging various technology solutions, using their smart boards, swivel cameras, creating flipped classrooms, and really redefining and choosing to use this as a moment to not go back to what we knew school used to be. And I know it's a really difficult process when teachers are being challenged to think about this at such a rapid pace, but there's a lot of opportunity for innovation and creativity. Where we are seeing, and I want to acknowledge this too, where this becomes of a greater challenge is in teachers who have very unique positions and maybe isolates in terms of the type of subjects and or courses they teach. An example of that may be like a high school Latin teacher. There may be only one or two Latin teachers in that school, and trying to identify how best to support that person. We're also looking at ways to actually connect teachers across schools And we're doing that already with our full-time remote academy to be able to leverage teachers and their capacity in a different way. I think we have to approach this positively and recognize it's going to be iterative. It's not going to be perfect, but we're going to learn from each other in this process in terms of how we can best support each other, and know that we are going to be looking to identify best practices across our schools to be able to make sure that we share that with all of our principals and teachers, both in our direct-to-teacher weekly email as well as through our monthly school leadership meetings.
Thank you. Our next question as voted is one, what is the district's liability if an employee contracts COVID at their place of work and becomes sick or dies? We understand the gravity of this question. We must say that that is a question that it is not possible for us to answer universally in a way that applies to all employees. Any such case would be fact specific. And so to answer for all employees who may be on this call or have that question wouldn't be possible in a universal manner. And so our advice would be that our employee resource, Life Care, has limited free legal resources and advice. And that would be a good place to start with that question. Our next question is, why should I have to pay a sub if I was told to put my work on Canvas for the day and there's no human filling my spot for live teaching?
Thanks, Patrick. I'll take that question from a human resources perspective. It's actually a really good question, and it's based on how the position or the vacancy or the daily absence is coded. If you do not need a sub for the position for coverage, then you should not be paying the sub fee. So the sub fee is dependent on how the absence is coded. If there's not a sub needed to cover the position, then the absence code is used of 26. So the fee is not applied, but if a sub is needed for the position, then a code 6 is used. And you can double check with your financial secretary if you need to follow up to make sure that your school has coded your absence correctly.
Thank you. Our next question. How can it be safe to have students eating in the classroom with their teachers?
Thanks, Patrick. I'll take it. So I think it gets at the central intersection, social distancing and classroom space size. Our original intent was to maximize the, the original intent was to minimize the opportunity for student movement. We're trying to mitigate exposure across the building. We recognize now that there is some opportunity in some of our cafeterias to appropriately social distance students for lunch. Principals are working on a plan for that. And as you are aware, as the governor relaxed restrictions for K-5, we are actually bringing more students in at a time. And I think that opens up the possibility to use cafeterias. Social distancing is still going to be important. And yes, we understand that we expect kids to take their face covering off while they eat, as we do you. And so we are hopeful that following the guidelines that are in place, that we'll be able to offer a safe lunch for all of our students and staff.
Thank you, Kathy. We have a question related to newly available CDC guidelines. And the question is, what is CMS doing to protect staff and students in low airflow rooms? That's a question.
Hi, everyone. Hi, everyone. So the CDC guidelines, they ask for increasing the outside airflow where possible in order to dilute the indoor air. That is one way of reducing the risk of aerosol transmission of SARS-CoV-2 virus. What we have done is, these are the steps we have taken and are continuing to take. We are focusing proactively on the corrective actions in order to improve the HVAC operational controls. We have extended the HVAC schedules. and literally they are running 24/7 since August the 1st, and it would continue to stay as is in order to continually provide the airflow throughout the day and night. We have upgraded our filters from MERV 8 to MERV 10. That was the best improvement we could do in our filtration systems by keeping our system constraints in view. In addition to that, we have during the summer break, we verified the functionality of all exhaust systems throughout the district. We completed one cycle of verification and are currently into the second cycle, verifying all the exhaust fans are running at their optimum speeds. That helps in air movement from the hallways in through to the restrooms out to the atmosphere. There are between 11 to 1,200 classrooms across the district that have either no outside air available in the systems, that is the system constraint, or they have the limited outside air. That means we have fixed outside air dampers and we are not able to increase or decrease the airflow. So those classrooms that don't have outside air capability, the recommendation from CDC is to open the windows if they are operable. If there are no operable windows, then they need to keep the doors open so that the air moves into the hallways, and from the exhaust systems, air moves through the restrooms out to the atmosphere. That way the air continuously is on the move. There are 39 sites or 36 schools that have these classrooms which have no to limited outside air capability. We have already completed air system optimization of 22 out of those 39 sites. And by air system optimization, what I mean is that we clean the whole air circuit of the HVAC system and do the antimicrobial treatment. This ensures that the airflow through the system into the spaces is as close as to the designed. For the remaining 17 schools, we have already completed the bidding process, and the air optimization for these 17 sites would soon begin. And it will take some time to complete, and our plan is to complete the air system optimization during this school year. But having said that, all our systems, they have been verified. The airflow is not low, than the much lower than the design. And we consider, because in the design, the airflow, there's some tolerances are kept. And because of those tolerances, the system, despite delivering a little low airflow, they are able to maintain the space temperatures. So our systems are able to maintain the space temperatures. That means the airflow is within the tolerance. By completing the HVAC air system optimization at those sites, we would actually enhance that airflow as close to the design level as possible. In addition to that, we contracted 3 engineering firms to provide us some recommended solutions. There are so many products, so many solutions available these days, and we wanted to have a solution implement in the classrooms that have limited to no outside air capability. And we have received the reports, and we will be going with the needle point bipolar ionization system to be installed in each of the HVAC unit that serves those classrooms, which I mentioned was between 11 to 1,200 classrooms. Currently, we are in the bidding process, And our installation, I anticipate to begin somewhere in January, February, and we are planning to have all this work, this upgrade completed by within this school year. This would be, in fact, a permanent solution, not just addressing this COVID, but going forward, this would significantly enhance the indoor air quality. What needlepoint bipolar ionization is, that it sends out positively and negatively charged ions into the space, and which attracts all the smaller particles together, and then those bigger particles pass through the filter in the HVAC system and are caught at the filter level, and that way it continually keeps the space air quality cleaner. Thank you.
Thank you. Next question. Some employees are still resisting proper mask wearing. What disciplinary action can be taken?
Hey, Patrick, I'll take that one. So just first, to be clear, it is not optional to wear a face mask. So we are requiring face masks for all employees. The only exception to that is if an employee has received a medical exemption to wear a face shield or some other accommodation through human resources. That said, since it's a directive, it's an expectation, as we would do with any other issue, we would work directly with the principal or the supervisor if an employee was being non-compliant to resolve that issue as a personnel issue.
Thank you. Next question is for operations or health, and it's related to some variances with thermometers. What is CMS going to do regarding the issue of potentially faulty thermometers or poorly recording thermometers?
I'll take this one, Patrick. We know that temperature taking is really just one of the many measures we use to identify anyone entering our building that may have COVID-like symptoms. In addition to our screener on site, we also encourage families to monitor for symptoms before they come to school as well. We know the forehead thermometers are not as sensitive and accurate as an oral thermometer, but they were provided to us by the state because they can take temperatures quickly and without direct contact with the other person, so that lowers risk. But again, we do know they have limitations. We've notified the state about some of the concerns around accuracy. We've also sent out some guidelines and directions on how to recalibrate them to make them closer to an oral temperature. And we have some additional notes on ways to optimize the use. If your school needs replacement thermometers, notify your PPE contact in your building and they'll help us.
Thank you. Our next question is it really safe to go back?
Monica, I'll give you a minute to catch your breath and you can jump in behind. So this is a question that we have spent a great deal of time thinking about since we closed school last spring. How will we know that we are poised both as a community and as a school district to return to school? As you're aware, we looked very specifically at county health metrics as one of our leading indicators of safety to return, and we set a threshold around that. And if you look at our metrics dashboard, you will see that we are poised to bring students back for in-person instruction in phases. While the governor indicated it was, he felt statewide, it was the metrics would indicate as a state we were okay to bring all of our elementary students back. We made the decision to start small with students with disabilities that were of a certain nature that did not allow them to take benefit from remote instruction. Then you may or may not know we've added pre-K students to that. And then we will, in another couple of weeks, add elementary students in a phase. We are tracking both metrics that we feel confident about in terms of being able to offer in-person instruction. And we will monitor closely how that plays out, both school by school and across the district. And when I say we will monitor it closely, what do I mean? Well, we're looking at the number of positive cases that occur in schools, the number of close contacts that warrant quarantine, and our county health metrics. Are we continuing to trend in a direction that indicates that we are poised to bring students back for in-person instruction? So we're taking it carefully. We have a measured approach. We've developed that measured approach with the help of Mecklenburg County Health Department and our colleagues at Atrium and Novant, and we feel it's a solid plan.
And I would just add to that that we do know that not one metric is going to make the decision for us about whether we need to change course. And so we have to really take it all into consideration together. And there's no absolutes in this pandemic.
Okay, we understand that our guest, Dr. Washington, is here with us. We'll take two more questions, and then we'll invite Dr. Washington in to share our information about the COVID testing. Move forward with the next couple of questions, and the next is, will teachers and/or staff members who are exposed to COVID in the workplace be eligible for workers' compensation?
Patrick, I can take that one. That's a really good question. We would handle those the same way we would with any workers' compensation report. The report would need to be filed as it normally would, and then it would be investigated as all workers' comp issues are, and then a determination would be made at the end of that investigation. But with that, I want to add that if we have employees who are exposed to coronavirus and have to quarantine or seeking a medical diagnosis, there is federal paid leave available for them. And so that is something that, you know, if that's something that you're experiencing, you need to reach out to benefits so you can apply for that because that's something that would be available as well.
Thank you. And one more question before we invite Dr. Washington in, and that is there a way to anonymously report safety issues that the school isn't handling?
Yeah, Patrick, I'll take that as well. Yes, definitely. You have a couple different routes. You could go if you don't feel comfortable speaking up at your school. You can always reach out to the Ombudsman's office through CMS, either through their online portal or by phone. But really, in employee relations, you can call us. You don't have to give your name and let us know what's going on. You just need to give us as much information as you can so that we could investigate it and get a resolution. So you can always do that anonymously as well.
Okay, thank you. And we'll pick back up after we share this information on the COVID testing. And we have Dr. Reynard Washington from the Mecklenburg County Health Department, who is here with us, and we want to thank him for being here. And I believe some of our other staff members on this call might be able to, on this meeting, might be able to provide some input as well. But Dr. Washington, thank you for joining us.
Yeah, sure, my pleasure. And good afternoon, everyone. I am happy to be with you all this afternoon or evening, really, to talk a little bit about an exciting opportunity that we are really excited to bring to you all in partnership with not just the local health department, but also in partnership with our state and federal government partners in public health. So we are offering one-time COVID-19 testing for all CMS teachers and staff. We are going to be conducting this testing over the course of the next 2 weeks. There are going to be at least 8 opportunities for you to be tested. So we have sites at 4 schools that have been selected throughout the county. I believe you all received a communication yesterday or earlier today with details of how to register and where the sites will be held. So just a couple of things I want to point out. This is one-time testing. This is a resource that's been made available to us here in the county. And we only have it for this one time. And as you all know, we traditionally don't encourage everyone to be tested because, in fact, we want folks to be tested who meet certain eligibility criteria. And that is folks who have either been in close contact with someone who's tested positive or individuals who have symptoms that are similar to COVID-19. Because this resource is available And we have this additional surge testing available. And we know that CMS is preparing to have more students and faculty and teachers and staff back in school buildings. We thought it fitting to make sure we make this testing available to the CMS community. So we're really excited to do this. And this is a pretty large operation. So I really encourage folks to go onto the website and register as soon as possible. If you all can help us out by doing that, that allows us to be able to plan appropriately for how many staff and teachers and faculty members are going to be on the various campuses at the various middle schools throughout the next 2 weeks. So the testing will occur on Monday the 19th and the 20th, next Monday and Tuesday at Wilson Middle School. Then again, next Thursday, October the 22nd and the 23rd. There was a little bit of a mix up with the dates in the email, but it is the next Thursday and Friday at J.M. Alexander Middle School up in Huntersville. And then we'll have testing again on Monday, October the 26th and 27th at Albermill Road Middle School. And then finally on Thursday, October the 29th and Friday, October the 30th at J.M. Robinson Middle School. Again, it's very easy. There were instructions in the email. First, I'll say this is no cost testing at all, so there's no cost to you all. You must pre-register though. It's really, really important that anyone that wants to get a test completes the pre-registration process. And so you can just go to www.doineedacovid19test.com. And once you get onto that website, you'll just need to use your CMS or any email that you like to use to register for a test. It will ask you a series of questions about your date of birth, your address, your telephone number. It's really important that you put an email address in there, and it's really important that you put a telephone number in there, because those two are essential for us to get in contact with you if in fact your test comes back positive. Also, you must bring the voucher. So once you go through the registration process on the website, you'll be able to select which site you would like to go to, and you're able to select an appointment time. So we have appointments in 10-minute windows, and this really helps us, one, again, to be able to anticipate how many folks are going to be coming and to kind of control the traffic at all the individual sites. This will be drive-through testing, so you won't have to get out of your car at all. And again, you need to definitely print the registration voucher that the website, the doineedacovid19test.com will produce for you. You must have that voucher to be tested. So you cannot get a test if you don't have one of those vouchers, and you must print the voucher. So it has to be on a piece of paper. It can't be on your phone. It can't be on your iPad. It has to be on a piece of paper because the voucher will ultimately go with your specimen to the laboratory. So it's really important that you go online, sign up and register there. Make sure you select the time window that works for you. Please try to come as close to on time as possible, so don't be too early and definitely don't be late. Because again, there are almost over 19,000 folks in your system. And so we're trying, this is a huge undertaking. And so we have partnership with the National Guard to help assist us to ensure that you all can safely and quickly get through this operation. So again, please, we want as many of you all to pre-register as soon as you can, so don't delay. The registration sites are open, and now, when I checked earlier this morning, I know at least 200 of you all had already signed up for an appointment. And so again, we really want as many folks as possible to participate in this process with us. Again, it gives us a good sense. It's another added measure in our toolbox. As Monica just mentioned a little while ago, minimizing the risk of COVID-19 spread in our schools takes a whole range of tools. And this sort of one-time testing of all the teachers and staff gives us an opportunity to identify any potential active infections before we have more folks engaging in the school system. Now, it's important to know that the testing is one time. This gives us an assessment of where your status is on the day that you get tested. It's very possible you could leave the test and go out and be exposed to COVID-19 and become infected. And so it's really important to understand that this test is not sort of a green light. It just gives you a sort of a point in time view of whether or not you have an active infection or not. This is a molecular PCR test, so it will be a nasal swab that you'll actually collect yourself. So just to give you a little bit of a sense of what to expect, it's sort of a Q-tip, and you swab both of your nostrils. You'll put it into a vial, and then a nurse practitioner or one of our medical staff will be there to be able to help you through that process. The results should all mostly be back within 24 to 48 hours, but because they are being shipped to a laboratory overnight, they will potentially, some of them may take a few days before they are returned. But again, the majority of them will be available within 48 hours. Again, you have to provide an email address. That's really important because you'll get a notification at your email address when your results are ready. And you can just go back to that same website, doineedacovid19test.com. You will log in using your email and your results will be there for you to view. And the results, if your results happen to come back positive, you will also get a telephone call from Mecklenburg County Health Department notifying you that you have tested positive, and then we'll talk you through all the next steps that you need to. Again, if you feel any COVID-like symptoms, or if you know that you've been exposed, you certainly should go get tested before your appointment. So don't wait to get tested because this opportunity is available. All you need to bring with you on the day of is just the registration form. So you don't need your health insurance card. You don't need your ID. You just need the form. And again, our team will take care of you when you get there. At this time, testing is only available for folks who are employees of the school district. And so it's really important that you don't bring other people with you to the testing. And as I said, you don't need your health insurance information. So again, it's www.doineedacovid19test.com. You'll just need to register. And once you complete the initial screener, you'll be allowed to register for tests in Mecklenburg County. If you don't happen to live in Mecklenburg County, you will have to change the zip code on the testing appointment page to a Mecklenburg County zip code so that you can see those testing sites in Mecklenburg County. And again, if you have any other trouble, feel free to just reach out to your principals or school nurses. And of course, we look forward to seeing you all. If you have any questions, we're here. I'm happy to take any questions now, Kathy, if that's appropriate.
I think for this, we just wanted to have you come in and share this news that is exciting, and on behalf of Charlotte-Mecklenburg Schools, I would say thank you to the County Health Department and our other partners. And I know that those others on this call would echo that sentiment for helping to inform our 19,000 plus employees in this really challenging time. Thank you, Dr. Washington, very much.
Yeah, my pleasure. And again, I will tell you all, we have over 30 medical staff, and we have 10 or 12 National Guardsmen and women, and a whole host of folks from the health department coming to each one of these sites every day. So please sign up, please register. We don't want to have all these planning for naught. So, and try to do so as soon as possible, because the more we know ahead of time, the best.
Thank you, Dr. Washington.
Thank you all.
Feel free to stick around if you'd like to hear the rest of our question and answer session. We thank you for being here.
Thank you.
Now, as we are thankful for Dr. Washington for being here, we're going to move along with continue the questions we received from our employees and staff. The next question is for academics, and that is, what is being done to protect the special course teachers, examples given art, PE, music, from being super spreaders as they are asked to enter multiple classrooms?
Thanks, Patrick. I'll take that one. As Dr. Washington and Monica and Kathy have alluded to, and as we've also framed to our Board of Education, the safety of our students and/or our teachers and faculty and staff is of the highest priority. I think for this particular question, I think it's important to note that our elective teachers will still, regardless of whether we were cohorting students or cohorting teachers and having them move, our teachers will still have the same number of assigned students to them over the course of the day in each of these blocks. And so actually cohorting students and asking our elective teachers to move into individual classrooms actually limits the opportunities for movement within the building. It promotes social distancing and actually reduces the opportunity for spread. We would like to encourage our elective teachers, as well as all teachers, to think about outdoor activities that may be appropriate to ensure that we can offer some of these courses when the weather permits to be able to do that. And I also think this is an important opportunity for us both as staff, as well as how we encourage our children, that when we are out of school, we have to encourage our safety in those practices of wearing our mask, to be socially distancing and washing our hands, because a lot of our behaviors outside of school we know will actually trickle into the schoolhouse. So again, we feel really confident that this actually reduces the amount of mobility and movement in our school buildings, and actually puts our elective teachers, our specialist teachers, in a better scenario that actually promotes healthiness. So thank you, Patrick, for asking this question.
Next question for HR. Teachers were declared essential workers by the U.S. government and the state of North Carolina. Will there be hazard pay and or raises for teachers?
Hey, Patrick, I've got that one. No, we don't have that available. As public school teachers, pay is designated by where you fall on the state salary scale, and we haven't been allocated money through state or federal government to provide that incentive.
Thank you. Our next question is health related. The submitter wants to know how many COVID cases are at his or her school each week, not the district. Will this happen?
I think that yes, it will happen. It's currently happening in schools where we have had positive cases. Both employees and students, impacted students and families have been notified. We're tracking that very carefully. So note that in schools where we've had positive cases already, as we do with any communicable disease, there's a notification process that happens with support from our county health partners. We will post for the public at a time to be decided upon soon cases that are happening by school, so that we can notify the general public what that looks like as we go forward with the next phase of in-person instruction when we add our elementary students.
Thank you, Kathy. Will the 30-day resignation notice be waived due to the circumstances?
Thank you, Patrick. We do understand that circumstances occur, and sometimes employees have to make decisions to pursue other opportunities, and they have to resign from their positions. But even in our current state, we will continue to follow our CMS Board of Education policy, which is a 30-day notice, 30-day working notice for instructional staff members. However, we're also now adding that if you feel you have an extenuating circumstance, it can be reviewed. So an extenuating circumstance is not necessarily someone that is resigning because they're accepting other employment. We get that every day, but something that's outside of the norm. And so we'll review those on a case-by-case basis, and you can provide that sort of supporting documentation for your situation. This information can be sent to your human capital partner for your school or department. If you don't know who that person is, your building level principal or department can tell you who that person is.
All right. How will absences be handled as far as getting a substitute to come to your class if you are out?
I'll take that one as well. Now that we have staff and students reporting back to our school buildings, we will follow our normal process to request a sub. So if you're at a Title I school, you will still go through Kelly Services to request a sub, or you can go through SmartFind if you are a CMS sub. At this time, once students start reporting back, we will start to use subs for daily needs in addition to our staff that have approved leave of absences once your grade level start back in person.
Next question, the internet at schools doesn't support the amount of people trying to teach virtually. Is there a plan to increase internet capacities to support teachers?
Thank you, Patrick. I'll take that one. Actually, Derek Root in our technology department has ran a check on all of our schools, and there are wireless hubs in all of our schools that should support that. That was a huge initiative of ours as we transitioned into the one-to-one initiative, is to make sure that we were able to hold up on the internet capacity of that. If there are any schools that are experiencing specific issues that are pertaining to that school itself, or some of those wireless hub devices, if they just need to notify their principal or whoever their tech contact is at their school, they'll put in an order, a work order for that, and we'll get people out there as soon as possible, make sure that that's corrected.
Thank you, Matt. Teachers are to get duty-free lunch. Will we be getting paid for supervising students eating in our rooms instead of the cafeteria, since we are now losing that?
Yeah, good question. We've gotten this one here in the last few days. So teachers do get duty-free lunch. And in some cases now, students are still going to continue to eat in the cafeteria, but others may not be able to due to the cafeteria sizes and the number of students who may be scheduled for in-person, right? So schools may have students having lunch in their classrooms, and teachers may need to cover during that time. However, We are asking principals to create schedules to accommodate for breaks, which would be duty-free lunch period, but it may be outside the normal lunch time.
Thank you. Why are teachers with a spouse that is ill or has a critical illness and going through treatment not allowed to continue to teach remotely?
Patrick, I'll answer this one. This is a really important question. So not only are those who are battling cancer or going through radiation treatment or chemotherapy high risk for COVID, but the CDC has several categories of people that would be high risk for COVID. That includes, so it's pretty broad, that can include diabetes, it can include chronic lung disease or asthma. So just the number of people that impacts are employees who have family members that may fall into one of these categories, or if they even care for someone that falls into this category. If we were to expand remote, work accommodations for all of those, all of those employees that we're living with or caring for someone that was high risk, it would impact so many that would really affect our ability to operate school, especially now that we have students coming on site and in our buildings.
The next question is why are we being forced back into the building 2 weeks before our students? This time can't be used to set up workspaces, so why can't we continue to work from home?
Thank you, Patrick. I'll take that one. Actually, we've had several teachers as we met with some of our groups early on that were asking about having the opportunity to be able to get into the rooms before we bring students back. So they can prep those rooms and have them ready to receive students. Also, we know that several of our buildings, we may have 50% of our teachers who are now working remotely, up to probably in some schools, 80% of our teachers that are working remotely at this point in time and teaching in our K-5 facilities. There are procedures and processes, screenings that got to take place, making sure that everything's done properly as teachers come back into the building, as our custodial services come back into the building, as our cafeteria workers come back into the building. All of that takes time, and I will personally tell you, as I've watched schools that have started that process from the first day of school, where they had a lengthy line of individuals lined up. After about a week and a half, that process becomes a very efficient process because they're used to the flow of those screeners and what has to be done, and people fall into the roles of checking individuals as they come into the building. So this allows for us to have that opportunity. It allows for our schools to have that opportunity to prepare the adults, to prepare the building in order to receive students back into an academic setting.
Next question is, how will teacher absences be coded when we are out on quarantine? We shouldn't have to use our sick days.
Absolutely. This is actually a federal law under our Families First Coronavirus Response Act. So employees that are quarantined due to COVID are covered under this act. However, the employee will need to complete the FFCRA application and return it back to the benefits department. And if for some reason your days are used, once you have the approval from the benefits department, your school can update the code with the code 83 so that you are not charged for that time.
All right. Rumors are circulating that no one can work from home in the second semester. Is this true even with a doctor's note?
Hey, Patrick, I got it. Yeah, I know there's a lot of anxiety around this question, especially with our staff that are approved as high risk and are working remotely and wanting to know what that's going to look like come second semester into January. And we just don't have a determination yet. It's mid-October, but we have a lot of factors to consider. I can just tell you that as soon as we're able to make a determination, those work expectations, whatever they are, will be communicated to all staff.
All right. How will the district enforce student mask wearing?
Thank you, Patrick. I think, this is one of the main things that we stated in the board meeting as we not only went over the first plan of reentry, but also when we talked about the recent plan with the K-5 modifications. It's everyone has to wear a mask. There's no question about that, and we're gonna hold tight to that. We have certain situations due to students and adults, that have special provisions that are provided to them because of medical reasons that they may not be able to and so forth, and we'll take care of that. But for the large majority of a whole, everyone is expected to have on a mask. And any situations that we have where students or adults aren't wearing a mask, the first thing we're going to do, is we would hope that anyone would do, is engage those individuals in a conversation around the expectation and the reason why it's important to wear a mask, reason why it's important to have social distancing, the same reason why it's important that we remind each other to make sure that we're washing our hands routinely. So we just hope that everyone will respect everyone in their space and make sure that they're doing that. Anytime we may have a situation that may extend past just a general conversation of respect, then what we'll do is we'll ask for various individuals that are supporting those schools to step into those schools and engage, whether that's a staff member or family member, whoever that is, and or students around the need to make sure that they're wearing masks, not really just necessarily for their safety, but definitely for the safety of others that are in and around them in the school setting.
Why are remote work accommodations not being applied consistently throughout the district for high-risk individuals who've submitted proper documentation?
Hey, Patrick, I got this question, and I appreciate this question being asked. Right now, I think we have just over 700 teachers that are approved to work in a remote environment, just over 900 total staff that are approved to work remotely. We've been able to do this to date based on the number of students that are enrolled in the virtual and the remote academy. But we're in a much different landscape than we were when everyone was working remotely, or every student was learning remotely in Plan C. So as students phase back into the buildings, we have to be able to ensure that the needs are met for those students. And it really depends on the individual teacher, their caseload, the staffing needs at their school, whether they will be recalled to come on site for some period of time. So honestly, it depends. And I think the question says, what about consistency? It feels inconsistent. We want to be as flexible as possible and offer that remote work for high-risk employees wherever we possibly can. But that means that we need to look at individual, who they teach, where they teach, the circumstances involved, to ensure that we can continue a remote work environment.
Next question, how will my room be deep cleaned on Wednesdays if I have to be in it all day and cannot work from home?
Yes, Patrick, I'll take this. With our processes, it will be clean, but deep clean is not a process that we'll be doing. We have a consistent practice that's consistent across the country with the national process, and what we're trying to do, make sure that we're sanitizing, disinfecting throughout the day, wiping down high touch points, making sure the rooms are clean at the end of the day, being disinfected every day, desks and classrooms, and the common areas, things of that nature. And the restrooms on Wednesdays and Fridays will be washed down. So that's the best practice we'll be following, which have also been blessed by the health department.
All right, the next question is directed towards academics, and that is, I signed my child up for the full remote academy under the premises advertised by CMS that she would have a dedicated full remote academy teacher. Now I am hearing that is not the case. Why?
I'm going to pick up on some elements that Laura French was sharing around the complexities of balancing both remote instruction and at our in-person instruction balance. As you know, you may or may not know, but students selected full remote academy in varying numbers across our schools and grade levels. As we have phased in-person instruction back in, we made it really clear that we were going to need to look at schedules by school, by grade level, in order to be able to ensure that we could balance the number of students that were going to be receiving in-person instruction with that against the number of students who would be in the full remote academy. We are finding in some instances that those schedules may need to change to accommodate in-person instruction. And that is not something that we take lightly, but we are going to have to make some accommodations to do both to the best of our ability And that's just the way it's worked out as we are beginning to phase in more and more students for instruction. And if there's anything I missed, Matt or Brian, feel free to add.
Yeah, thanks, Kathy. The only thing I would add to it is that our principals across the district in our K-5 elementary schools, they understand the relationship that's built amongst the teachers and the students over a period of time, and they want to honor that to the best of their ability. So the unfortunate incident of having to possibly, transition a student to a different teacher is probably the last resort that many of them are going to take. So I just want to share that with you, that it is not something that's a lighthearted decision. It's not something that is the first decision. It is the last and only when it is it's the last resort and the last piece of change that we would have to make in which to make it fit. So we appreciate that. Thank you.
Why isn't the teacher observation tool updated to reflect our current reality?
Yeah, that's a question we've been getting since March, since our reality somewhat changed, right? So we have received some recent guidance from DPI, and what they have stated is that even though the NESIS process was developed originally when remote instruction was not even being considered, it is still determined and still provide effective formative support and can be used for full remote instruction or blended instructional models.
Thank you. Our next question is related to what is specifically being done to those schools with known HVAC issues.
In my previous answer, I had comprehensively covered what all we have done for the schools, focusing on the schools with no to limited outside air capability. In addition to those, we are actively monitoring all the work orders backlog on a daily basis, and we are prioritizing the schools with no to limited outside air capability.
Thank you, Makar. If a student states that a family member or classmate has COVID, what actions are taken to definitively prove or disprove that student's claim?
I'll take that one. We may be unable to verify whether someone outside of our school community is COVID positive. I'm not sure if they were asking about rumors or knowing about an infection in the building. If there are claims of a student or staff member with COVID-19 infection and that may impact our schools, we would work with the county health department to investigate that claim of a positive case, and that investigation would also include confirmation of a positive test.
All right. Next question is about expectations of cleaning and wiping down classrooms and whether that is against CMS's bloodborne pathogen training.
I'll take that one. This is a very interesting question. I don't think under the umbrella of the bloodborne pathogen standard as written by OSHA and the Department of Labor, that this would really fit under that. However, if we want to look at it as fitting under that, we would want to practice, and you may remember this from your training, universal precautions. So basically that would mean we would say, okay, the virus is here, even I'm cleaning this area, I got to assume it's there. So we would wear our mask, which we need to be doing anyway. And then if you are cleaning, we would wear vinyl gloves.
Thank you. Next question we have answered in part, but we'll ask it. How will high-risk approved remote accommodations be handled after the end of this calendar year, December 31st?
So again, a determination has not been made. We understand though that high risk doesn't go away after December 31st, that we will have high risk, continue to have high risk employees. But again, we have not made that determination. As soon as we do, we'll communicate it to all employees.
Okay, we're getting close to the end of the session. We'll take a couple more questions and then we'll wrap things up. Next question, what is the safest plan for support staff who push in and pull out students?
Thanks, Patrick. Actually, the safest plan is being developed right now by groups of our support teams that are connected to both our Exceptional Children's Department, who's had some experience with this already as we phased in students with disabilities, and members of our academics team are also looking at how are we going to provide both push-in services and pull-out services. And we are keeping in mind some of the things you've already heard Brian Kingsley say relative to cohorting students and having adults move versus students moving. And we believe that guidance will be out certainly prior to our K-5 students entering the building. So more to come on that.
Okay, next question is for HR, then we have one for academics, and then we will wrap up. Why aren't remote accommodations being honored for those individuals who are high risk?
Yes, kind of we referenced before, our high risk staff, it depends on what the person's position is. So we acknowledge we have high risk staff, and like I said, we have over 700 teachers now that are approved for remote work accommodation, but depending on the needs of the students that they serve, we may have to call some teachers back for periods of time to serve their students. I know that we've had questions about, hey, I'm an instructional assistant, I'm high risk, I've presented my documentation, you know I'm high risk, why are you requiring that I come back when students come back to the building? You know, am I as important as my colleague that is able to continue working remotely? And so I want to answer that directly. We looked at that, and we really looked at the critical need for the positions of our school-based staff, and especially with those instructional assistants and our school-based staff, we said, you know, these are our employees that work directly with students, and as students are coming back into the building on site, they would be transitioning students throughout the building, assisting with their daily needs. And so we really, in order to be able to operate safely with students in the building, we needed our school-based support staff, non-instructional staff, to be on site. That was a difficult decision because obviously, as we said before, we have staff that are legitimately high risk category, but we had to make that determination that, hey, in order to be able to do our work and to serve our students, we're going to have to recall those staff.
And our final question before we wrap up is for academics, and that is, how will the district ensure equitable instruction and assessment between students who return in person and those who remain remote?
Thanks, Patrick. I think this is a very appropriate last question because it's not just about instruction, our core business, but it's about equitable instruction. And we know it's going to take all of us in order to accomplish that. I think in terms of working together, it's going to be really important that the district and our teachers are working together to ensure consistency. In partnership with our teachers since last March, we've been building resources in our Canvas learning management system to make sure that our information, our curriculum, and our resources are accessible to both our employees, but also to our parents and students, regardless of modality, whether you're in person or remote. I think that consistency does promote equitable access, and knowing that paired with your great teaching is going to help to ensure that all children have the opportunity and the excellent teaching that they need in order to have those outcomes that we're looking for. I think this is also an opportunity for us to relate to each other and realize that quality matters more than quantity. And I think when we're thinking about the volume of work that we're asking of students as well as of teachers, we need to focus more on quality and less on quantity. We know what our standards are, and it's really important that we think about narrowing and going deeper and not wider. And lastly, I will share, I think it's really important that we continue just to work with each other in new and creative and innovative ways. As I left our last question thinking about, our teachers are co-teaching in many instances, they're team teaching, we're leveraging technologies in new and different ways, and we're continuing to learn from each other to ensure that we don't compromise equity and high quality instruction as a result of the pandemic. And we are committed to continuing to identify those best practices across the system and continue to share and learn from each other as we want to make sure that we support you and go through this with you. But we can do this. It's just a matter of continuing to remain positive, to be hopeful, and to make sure that we continue to support each other, focusing on the right things, which is quality and consistency.
Thank you, Brian. And thank you everyone on the panel for participating, but especially thank you to all employees and staff who submitted questions and who watched this and participated in this live forum. we appreciate your questions. We appreciate you sharing your voice. We want you to continue to do that. We encourage that. And everyone, almost 9,000 of you who participated in some way in the question and voting process, thank you for that. And I will close from a standpoint of, I think I speak for, hopefully speak for everyone who is a panelist, and also from the very top leadership of this district and those and our county health partners and others, in saying that one thing we can do is to continue to do our part as individuals and practice the 3 W's. Let's all be good examples, especially as we prepare to return in person, because we all have some part in this to make sure that our community continues to experience better control of the COVID pandemic, and we can wear our face coverings, and we can wash our hands frequently, and we can keep our own social distancing. And so thank you to all of you for continuing to do that and for being examples of that. Thank you, everybody, for participating, and we will now close the meeting.